On today's Two on Your Side Town Hall, we are counting down to Monday when that deadline hits for healthcare workers statewide to be vaccinated or lose their jobs. We'll talk about it with one of Western New York's biggest healthcare systems. Plus, is there a link between being overweight or obese and ending up in the hospital with the virus? We're going to verify more claims circulating online. And the Bills are back at home this Sunday to host the Washington football team. We'll break down some of the more interesting parts of that matchup with our Bills insider, Vic Carucci. And we thank you for joining us for the Friday Town Hall here on Channel 2. I'm Kate Welshofer. Michael is off tonight. We have got a lot to get to over the next half hour, but we are going to start with perhaps the biggest story affecting all of New York State in the coming days. It concerns vaccine mandates for healthcare workers. If an employee at a healthcare facility doesn't have at least one dose of a COVID vaccine by this coming Monday, they will likely find themselves without a job. Now, there are still some challenges to that mandate, as well as exemptions for things like religious reasons, but testing out is not an option if you're unvaccinated as of right now. So that's the situation. We're grateful to be joined tonight by someone who can help us answer a lot of questions surrounding this and help us learn more about the impact of this here in Western New York. Michael Hughes is my guest. He's the Senior Vice President and Chief Administrative Officer for Kaleida Health. And Michael, we're glad you're here. And I just want to jump right in with Monday because there have been some court challenges to this mandate, efforts to push the time back, but at this point it's still on. So what does this look like on Monday at Kaleida facilities? Was today essentially the last day for unvaccinated employees? Is this it for them, or is there more of a nuanced approach here? How's it being handled?
Well, in short, we're taking it day by day. So Monday, still have a few days for us to continue to work through the unvaccinated list, get to our employees and physicians who have not taken at least the first shot of the vaccine. But like you said, it is a bit nuanced here. Our employees have until 7 a.m. Monday morning. And that said, we are living in some uncharted territory here and some uncertain times, waiting to see what happens in terms of the compliance rate.
And while you're sort of going through this day by day, second only to that first question of what is actually happening here is going to be, what happens to patients? For example, will they end up waiting longer for care? Are they getting the best care? And I want to mention that the term healthcare worker is also very broad. There are so many jobs in healthcare facilities. So can you kind of break down for us the areas that are being affected the most? Are there ones in those patient-facing roles, or are they sort of more widespread than that?
Sure. So if you think about the amount of employees that touch a patient on any given shift or in any given day, could be dozens. So departmentally, could be environmental services, could be dietary, could be nursing, could be a physician. So all those patient facing positions are the ones that we're talking about here.
So what happens, Michael, on Monday? Like, what should patients prepare for or expect? Is that something that you can prepare for right now?
Well, again, Monday's still a few days away. Our goal is to remain open and have access to all of our services at all of our locations. Should we have a reduction in workforce, we'll make decisions as that comes about. We treat this no different than any other type of emergency, whether it's a snowstorm or power outage, COVID-19. So we have flex plans, we have surge plans, and we've been scenario planning all week, maybe the last 10 days, seemingly around the clock for this.
And we know that the stress levels have been high for healthcare workers as it is. There have already been staffing shortages even prior to this new vaccine mandate. So very quickly, we just want to remind our viewers what Governor Kathy Hochul said to unvaccinated healthcare workers back on Wednesday. Let's listen.
To those who refuse, we will find replacements. We'll be working very closely to have a multi-pronged approach, which I'll be announcing shortly.
So the governor says healthcare workers who refuse to get vaccinated will be replaced, and she'll be announcing a plan on how to do that shortly. So can you help us understand what that would entail for Kaleida? What would it take to actually replace every worker who could potentially be leaving, and is that even feasible?
Well, I don't think you could say we could replace one for one. I just don't think that's feasible when you look at our system, the Catholic Health System, and ECMC. So there's thousands and thousands of healthcare workers in Western New York. And there'll end up being a few hundred, we believe, come Monday that do not get that first shot of the vaccine and are out of compliance. So the way we look at it is our number one goal is safe patient care. That's the reason why we support the vaccine. It's the reason why we exist. We're here for our patients and for our community. So that's our number one goal, and everything we do, and our message to the community is, it is safe. Come to the hospital if you have a procedure, if you have a surgery, if you're sick. The hospital is the best place for you.
We wanted to ask you specifically about Oishei Children's Hospital. It's the only hospital in Western New York that the state's vaccine tracker lists as having 100% of employees vaccinated. But since we've reported that this week, we've gotten calls from people saying that's not true. So is Oishei really at 100%, and how is that number reported to the state?
So the way the state system is showing that's employees plus physicians. Would also include residents and fellows from the university. So those are folks who were assigned to that location. So overall, from a workforce perspective, we're in the low to mid 90s for Children's Hospital. But when you add in the physicians, residents, fellows, that number jumps to a quite higher number. So that's everybody who would be assigned to that site.
And finally, you touched on this a little bit, but healthcare workers have known that this deadline was approaching for a while. So can you tell us more about Kaleida's outreach to employees over the past few weeks, and more about your message to unvaccinated workers this weekend, as perhaps you hope probably that more of them will decide to get a first dose over the weekend rather than lose their jobs?
Yeah, our outreach really began when the vaccine first came to market. We encourage our employees, especially those who are facing patients at any given time, to get the shot. And that education and that conversation really has carried on for the better half of 6 to 9 months. Obviously, it's intensified since the governor's mandate came down. But, really, our employees have stepped up, and we're getting closer and closer. In the last 24 hours, we've had another 150 employees get the shot. So we're getting there from a compliance perspective. Will we be perfect? No, but that said, we do thank those who did get the vaccine. We know that they're here to serve our patients and really to make sure that, we have a safe and compliant footprint.
We do appreciate your perspective behind these headlines. It's certainly a conversation that we've been having throughout the week and will continue to have. We've been joined live by Michael Hughes, the Senior Vice President and Chief Administrative Officer for Kaleida Health. Michael, thanks again for your time tonight.
Thanks for having me.
Next on the town hall, we also learned this afternoon how Niagara County plans to help fix the shortage of bus drivers affecting school districts nearly everywhere. The Niagara County Clerk's Office announced school bus driver career fairs for all 3 DMV offices next Saturday, October 2nd. So anyone interested in becoming a school bus driver can come into any of the offices that day to take a permit test and meet with transportation directors and bus companies that serve all 10 Niagara County school districts. The DMV offices in Lockport, Niagara Falls, and North Tonawanda will be open from 9 to 1. That's next Saturday for this event.